The Rules Committee will come to order. We are here for consideration of the Fiscal Responsibility and Retirement Security Act of 2011, and we're happy to welcome members of the Energy and Commerce Committee and the Ways and Means Committee. And we appreciate the fact that Mr. Boustany has been a great champion of this measure for a long period of time. Why don't we begin by recognizing Mr. Boustany, and then we'll go to Messrs. Pallone and Gingrey. So without objection, any prepared statement that you have will appear in the record in its entirety, and we welcome your summary.
Thank you, Mr. Chairman, members of the committee. I'm very pleased that the Rules Committee is considering H.R. 1173, the bipartisan legislation to repeal the Unsustainable Class Act, a failed government-run long-term insurance program in the 2010 health care law. As free Americans, we're governed by the rule of law rather than the whim of individuals. Presidents should not selectively ignore parts of the law that seem inconvenient. This founding principle of our republic applies to all parts of the new health law, including the failed class program. Congress should repeal the class instead of watching the Department of Health and Human Services intentionally violate this part of the health care law. Last year, the Obama administration halted implementation of class after government attorneys warned HHS it lacked legal authority to exclude or delay enrollment of eligible disabled Americans. According to Congressional Research Service attorneys, if class remains on hold, the HHS Secretary will commit a facial violation of the law's requirement to approve a final design for the program by October. Congress would be wrong simply to look the other way as this deadline expires. Class is not only unsustainable, it's a new unfunded entitlement we cannot afford. Early in the process, the Congressional Budget Office warned, and I quote, "It would inevitably add to future deficits on a cash basis by more than it reduces deficits in the near term, even though the premiums would be set to ensure solvency of the program," end quote. Class is also a bad deal for Americans who will need long-term care, with premiums as high as $391 per month, a price which far exceeds private market premiums, according to the Urban Institute's Howard Gleckman. Under class, consumers receive no private contract that guarantees the benefits. They must meet a 5-year vesting period and forfeit what they contribute into a pay-as-you-go system with no reserve requirements. Mr. Chairman, as a physician, I have treated hundreds of patients who needed long-term care, including families with Alzheimer's disease. American middle-class families remain dangerously unprepared for these costs, thinking they have the coverage when they do not. Some people will spend more than $100,000 on this type of care. Private long-term care insurance offers a better approach, and we should make it easier for families to purchase this. I urge colleagues on both sides of the aisle to support class repeal. Long-term care reform is a bipartisan issue. Moving forward, we should make it easier for disabled Americans to save for future needs, expand access to affordable private long-term care coverage, and better educate Americans on the need for retirement planning. I went through this with my father a few years ago. It's been almost 3 years since he passed away. He did not have long-term care insurance. This is a problem that affects every single family potentially in this country. And there are good solutions out there. I'm working on draft legislation. I've been working with some of the Democrats on the House Ways and Means Committee. We can solve this problem. But when the President himself has said the plan is unsustainable, and yet there's a statutory deadline for implementation, we have a duty to act and take this off the books, therefore creating the impetus for real reforms in this very important area. Mr. Chairman, thank you for the opportunity.
Thank you very much, Mr. Boustany. Appreciate your very thoughtful remarks. Mr. Gingrey.
Mr. Chairman, did you want Mr. Pallone to go next, or you want?
Well, you're representing the Energy and Commerce Committee.
Absolutely, and I thank you very much, Mr. Chairman. Ranking member, I guess today, Mr. McGovern, and other members of the Rules Committee. I'm going to submit my written comments for the record in the interest of brevity, and I thank the Chairman. Look, this provision in Obamacare that was put in on the Senate side, this Class Act, quite honestly, needs to come out. Clearly, it needs to come out in its infinite wisdom former chairman of the Senate Budget Committee, Judge Gregg, amended the provision. And I think the Democratic majority at the time felt that that they were going to get this in there and weren't too worried about this amendment. But basically, the amendment said that the Secretary had to certify the fiscal solvency of this provision, this Class Act, this long-term care provision, over a 75-year period. We certainly, in my opinion, members of the Rules Committee, owe a lot of credit to the prescience of former Senator Judge Gregg, because that's the reason, quite honestly, after a 2-year period of study and many appearances before the Senate and the House in regard to this provision, that Secretary Sebelius finally said, look, she threw up her hands, I can't do it, there's no way. We've tried all kind of things. We've tried to mandate the provision. That would be just yet another question before the Supreme Court in March. There was also the suggestion that maybe we make people with pre-existing conditions have a 15-year waiting period of paying in premiums before they'd be eligible for benefits. All kinds of things were tried to come up with to make this program solvent, and they absolutely couldn't do it. Now, the President's Fiscal Commission back in December of 2010 basically said, if you can't reform it and make it fiscally solvent, then you need to repeal it. Now, that's not Phil Gingrey, a member of on the majority side of the Energy and Commerce Committee, saying that. That's the President's own Fiscal Commission. And the attitude that the President and the Senate majority and Ms. Sebelius, the Secretary of HHS, and others have taken as well, we're not going to do anything with this bill. So what's the big problem? What's the harm in letting it just kind of sit there? Well, that's not, I don't think, what we did when former Congresses, I think back in the early 80s, when Dan Rostenkowski was chairman of Ways and Means Committee in regard to this provision of catastrophic coverage under Medicare Act, and when seniors found out that we had passed this bill and it meant their Part B premiums were going to quadruple, the outrage was pretty strong, and that misguided, well-intended, but fiscally insane provision was repealed. And that's the same thing we do here. What is the harm? Well, the law says if it stays there, it just kind of sits on the books, that by I guess, October of 2012, maybe it's February, I believe, February 1st of 2012, if I'll change that, I think it is October of 2012, that there will be a program that seniors or anybody else who was interested in signing up for would have available to them. And if it's not, and it's in the law, what's to prevent them from bringing suit against the federal government in regard to this not coming through with a pledge and something that they're required to do by law? So the only way we can solve that potential problem and then let the free market continue to work on providing long-term care, assisted living, is to remove once and for all this flawed provision in the 2,700 pages of Obamacare, PPACA, Affordable Care Act. So that's where we are. We feel very strongly about it. It's a very simple bill. I'm proud to be here testifying before you along with my colleague, Dr. Boustany from the Ways and Means Committee. And with that, I'll go back, be happy to answer any questions from members of the committee.
Thank you very much.
Thank you, Mr. Chairman. I'm going to ask to submit my statement for the record. And thank you. And then what I don't usually do, but I feel like doing today, I would like to start out by responding to my colleagues, only because I am very concerned about the information that they're providing to the committee and the accuracy of it at some level. First of all, I should say that, I've been through, I guess, at least, January now, over a year since the Republicans took the majority, of an effort in the Health Subcommittee, which I'm the ranking member in Energy and Commerce, of just constantly trying to repeal every aspect of the Affordable Care Act, including repealing it outright. And I won't say never, because I didn't review every hearing and session since, in coming here today, but it seems to me it was rare, if ever, that I heard an alternative, that I heard a suggestion that, somehow there's a problem here, and we don't like this aspect of the way you're addressing it in the Affordable Care Act, and therefore we have some substitute or some other plan. And that certainly isn't true today. I mean, I keep hearing from my colleagues on the other side about how bad this Class Act is, but at no point is there any suggestion to change it. And I know that Mr. Bustani said that, you know, he's working to draft legislation. Well, why not bring it up? Why are we here today to repeal this? The Secretary has already said it's not being implemented. If you have a suggestion, then come up with the suggestion and, you know, let's bring it before the committee and go to rules, and we'll bring it to the floor to make a change that addresses the long-term care problem. The problem is that the Class Act was designed to address the fact that the private long-term care insurance market is not working. It's very similar to Medicare. In other words, before Medicare came along, it was very hard for senior citizens to get affordable health insurance. And so, you know, the Congress responded to it and the President by saying, let's set up the Medicare program so that we can cover all the seniors. And the same is true for the private long-term care. I don't have the statistics, but I think it's less than 10% of the people in the country have a private long-term care insurance, and it's very hard to obtain at an affordable rate, and that's why they don't have it. And so we're trying through the Class Act to address that problem. Now, you know, again, you may not like this solution, but then, you know, if you have an alternative, bring it up. Don't just come here and say we're going to repeal the Class Act. Now, I just wanted to mention a few things. Mr. Bustani said that it's unsustainable. Well, the fact of the matter is that in the House, the Class Act was voted on. It was voted on by voice vote, which means it was bipartisan. So it's not true that it was a Senate provision to put in the Class Act. What is true is that the Senate added the sustainability clause that said the Secretary had to look and see whether it was sustainable before it could be implemented. But I didn't want to give the impression that we didn't have the Class Act in the House bill. We did, and it was done by voice vote in the committee. I mean, you know, I'm the sponsor of it, so I remember. Now, what the sustainability clause said was that they had to certify it was sustainable. And yes, the Secretary certified that it was actually, the Secretary didn't say that it was unsustainable. And you actually did say that, Mr. Ganger. You said that she said that it couldn't be enforced. In other words, there were maybe 10, 12 alternatives, some of which were sustainable. But the Secretary said that she didn't think she had the authority to move to move with those provisions that were sustainable. And so, therefore, it really wouldn't take much of an effort. I mean, you could change the law, you know, fairly easily to provide for the Secretary to move on some of the sustainable options that she had in front of her that she felt that she didn't have the legal authority to move forward with. Now, one of the things that I've talked about is that, you know, you remember when we were in committee and we had a hearing on it, was I talked about this independent advisory council. Under the Class Act, there's a Class Independent Advisory Council that's supposed to be convened in order to offer expertise. One of the things that I've suggested is to the Secretary of the Administration is that they appoint people to this Independent Advisory Council, let them look and see if they have some suggestions that would allow the Class Act to continue. Now, I know my colleagues don't, you know, they don't want to do that, and it's clear because they want to just repeal it outright. All I'm trying to say, Mr. Chairman, is you really can't have it both ways. You're either going to say we need a long-term solution, long-term care solution, the federal government should be involved, and I don't like this one, but I'll give you another one, and let something like the Independent Advisory Commission do its work and see if they can come up with some way of implementing this either within the existing law or by changing the law. But all I hear from my Republican colleagues is very much the opposite. We don't want to do that. Maybe we'll do it down the road. In the meantime, let's just repeal this outright. And I think that in many ways that's just, you know, ignoring the problem out there. The problem of long-term care is getting worse. More and more people need long-term care. It's a drain on our system because, as you know, if you have to go to a nursing home, you know, you have to spend down whatever money you have, and then you're eligible for Medicaid to go to a nursing home. And so what's happening with at least the nursing home component of this is that the federal government is spending more and more money under Medicaid in order to take care of these people that are in nursing home facilities. The beautiful part about the Class Act is that it basically gives the individual personal responsibility. They pay into this trust fund with their own money, And then when they become disabled, they take the money out and they stay in their home or in the community, and they avoid the nursing home care that costs the federal government billions of dollars under Medicaid. So I would think, and I've told to my Republican colleagues, if you really believe in personal responsibility, if you don't want the federal government to be burdened with the obligation of long-term care, then you should support the Class Act, because this is, in some ways, other than the fact that it's a government program, it's exactly what the values are that you tout all the time. You always tout these values of personal responsibility, get the government out. You know, I understand it's a government program. You don't like government programs, but it's a government program that tries to keep people independent and lessen the cost of another government program, in this case Medicaid, which operates in such an awful way. I mean, I don't have to tell you. You know yourself, because you talk about your dad, I guess, right? And, you know, this system where you have to spend down your assets in order to go to, you know, a nursing home, it's just a very degrading way that people, you know, end their life. And it's also open to a lot of fraud. We've had, you know, situations with fraud in the case because people try to avoid this spending down. So I don't know. I don't want to keep going on, Mr. Chairman, but I really think it's a huge mistake to move forward with this repeal. There are ways to do this under the existing law or change the law, but let's not avoid a major problem that we have to address.
Thank you very much, Mr. Pallone. As I saw Ms. Fox sort of wink, as you said, other than the government program, I reminded the proverbial, other than that, Mrs. Lincoln, did you enjoy the play, you know? The fact that this is a government program is what is something that provides a great deal of concern, I know, for the two doctors sitting next to you. And I think that is really the key here. I think that we're going to be faced with this vote, and I know that there were amendments offered in the Energy and Commerce Committee, and we've had 3 amendments that have been submitted here, and we're going to have a chance to hear from Mr. Deutsch. I understand that his amendment is non-germane or a violation of CUTCO, so he has 2 amendments. I think they're both non-germane, but we'll still have a chance to hear from him on this issue. But I have no questions other than to congratulate you all for your fine testimony. Mr. Sessions.
Thank you, Mr. Chairman. Mr. Pallone, welcome, and my 2 Republican colleagues, I welcome you also. You know, Mr. Pallone, I had an opportunity for several years to sit over there and to hear you and Mr. Rangel and Mr. Andrews come and provide us legislation exactly as you've talked about that passed. And when we read the legislation, we would read that the government would arbitrarily undercut the cost of health care and allow people to opt out of it, to make it attractive to employers to opt out of providing health care for the benefit of coming to the government plan. Then as you read in the plan, you find out that these committees and commissions could make decisions that were binding without judicial or congressional review. They would be mandatory programs that would live on forever at the discretion of the federal government. And I am not just anti-government. That's not really where I come from. Rather, I come from a higher standard that I think that's rule of law, and that I think that we should have a rule of law that would be a standard, and the free enterprise system would have to live up to that. There are lots of examples about how much better and more efficient the free enterprise system is with rule of law as a governance over it. But I think that where Republicans are coming from is it's not working. What the President has done does not work. It is big government. It is more spending. It is government arrogance. It is taking over free enterprise systems, whether it be in energy or health care or financial services. This is an activist government that fights against employers. We've seen a tremendous job loss. We sat here and listened over and over again about this grand scheme, this plan that the President had and that Democrat majority would have for the country. We're in trouble. We're in real trouble right now, and we've been in trouble. But the trouble comes from when you take away the advantage of marketplace competition, creativity, innovativeness, and the actual ability for Americans to have a fight at providing the goods and services of this great nation as opposed to the government. And when you talk about the health care rules and regulations or the laws that have been passed, it literally puts 10 of probably the 19% of the health care system directly under the control of the government, of literally people who are unelected. We don't know their names, and they have control over our lives. So I consider that un-American. I think it does not work. And so today we're in a legislative process trying to effectively come and stand and say it's not only not sustainable, it is creating worse behavior and bigger problems. The answers that Republicans have many times is this, that we believe that the tax code should allow a person to use on a pre-tax basis for health care and insurance that which they need to get for themselves in the marketplace, and we can take care of ourselves quite well. You know, I don't have to run it at you today. I have a disabled son. I have a Down syndrome son, and I'm very concerned about those who cannot take care of themselves. That is the role of government. The role of government should be to take care of and to help those that cannot effectively take care of themselves. Those are seniors, those are intellectual and physical disability, and they are poor people. And when you involve the rest of everybody else and throw them into the mix, you diminish our ability to have a health care system that is leading edge and the greatest in the world. We should be hung up in this Congress on taking care of people that are have-nots, that three group of people that I'm talking about, not trying to mess around with everybody else and get involved in their lives and to form a system or something that's more expensive and does not work. So I'm going to continue to be an advocate for the free enterprise system. I think I'm an advocate for people with disabilities, because I guarantee you that as I approach 70, 80, and 90 years old, my baby son who turned 18 several days ago, he will be competing in a system that should have been designed for his success, not where he has to go and stand in line and compete against people mostly that would be in this room. And it's terribly, terribly distressing to me to know that the entire system could be in failure and that he will have to fight to get what should be rightfully his through no fault of his own, because we tried to run the system rather than solve the problem. And so I strongly believe in what we're doing. I strongly believe that if we do not allow the government to set the standards, whether it be when women get breast cancer screening or men get prostate screening, if we allow medicine and our doctor and common sense, as opposed to somebody who designs a system of how you can pay for it, as opposed to the outcome. And Republicans are hung up on outcome. We're hung up on getting health care better, and this federal government understanding what is in its strike zone, and that should be to help people who cannot effectively help themselves instead of running the entire health care system. So I think, in fairness to you, you'll be here many more times. I will be too. I don't mean to lecture you. You do not mean to lecture me. But Republicans do have ideas. We have regularly touted our ideas. We've been forthright about our ideas. And it would be, I think, disingenuous to say that we don't ever support or have better ideas than what are thrown at us. We care about people equally as you do, but are trying to find a model which works as opposed to non-sustainable. Mr. Chairman, I appreciate the time. I yield back.
Let me say a word in defense of our government. I think we have a pretty good government here. It's not perfect, but I don't know of any other government system that I'd rather live under. And I'm proud of programs like Medicare and Social Security, that provide a security and safety net for our senior citizens. Without these programs, millions of our seniors would be living in poverty. So, this constant drumbeat of how government is bad and government is talk about it as it's almost evil. Yeah, there are lots of problems with our government. There are inefficiencies in our government we need to fix. But I mean, just because our government is involved in something doesn't mean it is bad. Doesn't mean it has failed. When it has failed, we should change it. But this notion that's coming, quite frankly, from a lot of people in the Republican Party that I think is creating this distrust and this negative feeling about our government. I mean, we should be proud of this government, and so I wanted to say that because maybe because I listened to the debates and now I'm here and listening to what I'm hearing here. Let me also just say that I mean, if I'm understanding correct, the Class Act, if I'm right, would have been a voluntary program. Is that correct? I mean, that wouldn't force everybody to.
You pay into it
Right.
into a trust.
So it's not requiring everybody to be part of it. I'm all for the free enterprise system too, but sometimes a free enterprise system, when it comes to making sure people, get a fair shake, doesn't always work. And sometimes a free enterprise system in healthcare can produce a race to the bottom, rather than a race to the top. And I'll tell you, one of the good things about the Affordable Health Care Act is the number of uninsured young people has decreased as a result of a mandate in the bill that says that you can keep your kids on your insurance up until they're 26 years old. I think that's a good thing. If my friends on the other side of the aisle don't think it's a good thing, then, I mean, obviously they don't because they try to repeal it, but I think that's actually a good thing. So when it comes to health care, sometimes it is important for government to set some parameters and some standards and some requirements. I don't think that is a bad thing. We can argue until the cows come home about the Affordable Health Care Act, and there are philosophical differences here, and I get that, but I think it's important that people, don't lose sight of the fact that, we need some standards in this process. I just say, I think, this effort has kind of thrown the baby out with the bathwater, and I do think it's legitimate to want to know what you replace it with. I mean, you've said that this is a bipartisan issue, the issue of long-term care. If it really is truly a bipartisan issue, here's what I wish you on the Republican side would have done, especially on this issue, on the Class Act, where the Secretary of Health and Human Services has raised some concerns about the long-term fiscal viability of the program. I mean, this was an opportunity to sit down with the Secretary of Health and Human Services, with the people in the White House, and say, okay, let's see whether we can come to some sort of an agreement on, what we would replace this with, how we actually deal with this issue. And, and instead, what happens is we have a bill that comes before the Rules Committee, which is going to go to the floor to outright repeal it, and then, we'll see what happens. Yeah, I'm sure. Happy to yield.
You have to have two willing parties. You have to have two willing parties to come to some agreement. And there are ideas, but when the executive branch doesn't want to talk about solving these problems.
I don't believe that they don't want to talk about it.
Well,
I know
I can tell you, I'm talking from my own experience.
I know there are different ideas. Mr. Sessions' prescription for health care is take 2 tax breaks and call me in the morning. I get that. But on this issue of long-term care, I mean, it's hard. I'll yield to Mr. Pallone.
No, I don't want to interrupt you. I mean, first of all, I'd say to you, as the House sponsor of the bill, that I'd be glad to sit down with you and talk about, alternatives that we could do to implement and change the bill so that it can be implemented. I mean, I'll tell you that, right now. But, the one thing that I wanted to mention, and Mr. Sessions, I guess, left, but I don't want to take away from him because I know, he's had to deal with his child and all that. But the one thing that I wanted to say is, this in the Senate was Senator Kennedy's bill. And, of course, when I hear you as being from Massachusetts, I can't help but think about him. And he was very much, as all of you know, a believer that we had to bring the parties together and that we had to have practical solutions. I mean, he was clearly ideologically a liberal, but he always felt that there were ways that we could come together to accomplish things. And this was one of his crowning achievements, that, he wanted to do something for long-term care. And, when Mr. Sessions was talking, again, I say, we have a program, Medicaid, which is costing the federal government billions of dollars to address at least the nursing home part of the long-term care problem, in my opinion, in a very ineffective way. Okay? I mean, it's there. I'm glad we have it because I don't know what to, if we didn't have it, what would the people do? They'd be out on the street. But the fact is that the disability community came before the House, and again, on a bipartisan basis through Senator Kennedy. The disability community came to the House and the Senate and said, we really want to have something that addresses the problem in the community. We don't want people to have to go to nursing homes. This can save Medicaid, billions of dollars. This gives us our own personal responsibility that we're putting our money forward, and then we take it out of the trust fund when we need it, when we become disabled. So, I know you mentioned, Mr. Gingrey, about the catastrophic care. This is not like catastrophic care. There's the people that wanted this bill, in this case the disability community, are still supportive of it. They're not clamoring for repeal. And I don't know any employers. Mr. Session made employers, you're putting burdens on. I don't know any employers that are clamoring for repeal. I don't really know anybody, out there who is working on behalf of the disability community or working on behalf of employers that's advocating that this be repealed. There might be. But, I mean, it's not like this is not like catastrophic where there's this tremendous, grassroots movement to repeal this bill. Quite the contrary. All the groups that put this forward with Senator Kennedy are saying, we understand that we need to make some changes, and let's make them. But let's not just repeal it because of their very fear, as you said, Mr. McGovern, that once it's repealed, it's forgotten, and that's the end of it. So thank you for the time.
Mr. Chairman, if the gentleman will yield, and I thank the gentleman, in regard to the comments that the ranking member of the Health Subcommittee on Energy and Commerce, my good friend, and I don't question his heart, not at all, nor do I question the compassion and heart and comments made by Representative Sessions. In regard to Senator Kennedy, I mean, you're right. He was, in my opinion, you're right. He's a member that always tried to work with the other side of the aisle, and I have no doubt, had Senator Kennedy not had a terminal illness that really prevented him in the last several months of his life from maybe seeing the perfection of this act, the Class Act, and something that was a passion of his. It's understandable, but he wasn't able to, and I sincerely believe, from following the chronology of the bill, despite the objection from the actuary of Medicare that had 36 years of experience and said this is fiscally unsound, it won't work. It was really Senator Kennedy's staff that finally cut him out of the email loop and wanted to go forward, I think in a large part because of wanting a legacy to the Senate. I understand that. I think we all understand that. And one final thing, Mr. McGovern, in regard to this, Representative Sessions talked about our opposition on the Republican side to this bill, 2,700 pages, and talked a lot about that. But in this particular repeal bill of Representative Dr. Boustany, my medical colleague that I'm proud to co-sponsor, we're just talking about repealing this one section. This is flawed. No, and this really doesn't have anything to do with our argument.
No, but here's the problem that many of us who have supported this bill have, and that is that it's just outright repeal with no replacement. And if Senator Kennedy were around today, I think he'd say mend it and not end it. And I think he would, and again, I go back to what I said before, and my only point. I mean, I think, everyone talks about bipartisanship. I mean, right here on the, testifying before us, are three people who seem to get along and who, seem committed to trying to deal with the issue of long-term care. How refreshing it would be, if before we came with an outright repeal and said, well, we'll see you sometime in the future. Maybe we'll do something, maybe we won't. But I'll tell you one thing: is the status quo is unacceptable. We should all agree on that. How refreshing it would be if we came here and said, okay, you know what? We understand the financial challenges here, but you know what? We've come together, and maybe it's government, maybe it's private sector, maybe it's a combination of government and private, but we've actually solved this problem rather than just come here and repealed a portion of a bill which has some challenges, but I don't think it can't be amended.
If the gentleman would yield,
Sure.
Mr. Chairman. I think there's no denying that this is a very serious problem facing American families. We all agree upon that. There's no denying that, it's a pervasive problem. I've been going back and forth for the past year with the Secretary, pointing out where the authorities lie to make changes and where they do not, and asking for recommendations. And we've gotten no recommendations from the Secretary.
Well,
that's point number one. Point number two, there are some very good ideas put forth by both Democrats and Republicans, bipartisan ideas. They're not, politically charged ideas about how to solve this problem. Some of them deal with the education side, because we have a long way to go in educating the American public at an early stage to plan ahead. And then there are ideas about flexible savings accounts and things of that nature, a whole host of ideas. I've talked to a number of our colleagues on the other side of the aisle on the Ways and Means Committee. Why bring forth a repeal now and not deal with the rest of that at this stage? A couple of reasons. One, the administration's already come out and said they cannot make this work. And the second point I would make is that we all know how difficult it is to get things done around here. And it's hard to break through the noise and all the other activity. By repealing this faulty program, I think it then raises the bar. It gives us the impetus in a bipartisan way to actually do something on this very important problem. And that's why, as I thought about this, I said, how to approach it. I said, well, we need to vet some of these ideas. It's going to take some time. And that was a process that was not carried through when we had the debate on the health care law.
Well, with respect, I come to a different conclusion. And, and again, for those of us, who question, whether or not the leadership of this House is really trying to deal with the issue of health care or just outright repealing everything because it's an election year, it would have been refreshing, in my opinion, to have come here a month from now, if it took a month, or 2 months from now, and said, look at, here's an alternative idea that we've come together with in a bipartisan way. I mean, again, we all talk about bipartisanship around here. This seems to me to be one area where there could be some common ground. But, unfortunately, again, this is going to be a very, I'll guarantee you right now, it's going to be a very highly charged debate on the House floor, not only over this provision, but over the entire affordable health care provision, over every other, hot button issue you can think of. And I just regret that. I thank you. I yield back my time.
Ms. Fox.
Thank you very much, Mr. Chairman. This has been, I think, a somewhat enlightening discussion here, because I think we see the basis of the differences between our side of the aisle and the other side of the aisle in terms of how we deal with issues. I think that it's very clear that our colleagues across the aisle see the federal government as the answer to every problem in this country. If there's a problem, then the federal government should solve it. And I was thinking, as Mr. Pallone said, there are only about 10%, I believe he said, of the people in this country who have long-term care insurance. And I just wondered, I don't know what the number of people is in this country who have swimming pools at their homes, but let's assume it's 10%, okay? Probably a lot more people would like to have swimming pools. But I don't think it's the role of the federal government to go in and build a swimming pool for everybody who doesn't have one. And that's the kind of thing that you're talking about. So you don't have long-term care insurance. It is a personal responsibility to have it. It would be a personal responsibility to have a swimming pool. There are a lot of benefits to come from having a swimming pool. But how come the federal government isn't stepping in and providing a swimming pool for every family in the United States that doesn't have one? There probably could be a better analogy. I think about car insurance, for example. How different would our country be right now? I don't know exactly when mandatory car insurance went into effect. It was before my time, probably 1930s, 1940s, I don't know, when a lot of people started driving cars. People had to have car insurance. But we didn't decide at the federal government that it was the federal government's responsibility to take care of that. I'll bet in the early days not a lot of people had car insurance. Probably there was a time when 10% of them had car insurance. Well, the thinking here in Washington then wasn't, oh my gosh, only 10% of the people in this country have car insurance. We better do something about that. That's the job of the federal government. There's a problem out there, and we'd better solve it. No, the federal government decided that was something the states could take care of, and lo and behold, the states have taken very good care of that over the years. And now you can't go get a license tag for your car unless you can show proof of insurance, because if you have an accident, you're going to affect somebody else. The same principles could apply to health insurance. And for years, they did apply to health insurance. People took care of their own responsibility. And you know, average people out there are capable of purchasing their own car insurance. We don't need a government program to teach people that they've got to buy car insurance. You simply say, you got to have it if you're going to drive on the highway. And if you drive on the highway with an expired license tag, or there'll be penalties associated with that. Those principles could be applying to a lot of things that the federal government's now doing, where we see it's our responsibility to solve that problem. On the issue of, are there some good things that have come out of the health care program? You know, there are two ways to look at the issue of a lot more young people being on their parents' health care plan. Maybe it's because they aren't getting jobs, because this economy is so rotten based on the policies of this president and the Democrats who controlled the Congress for 4 years. That's why they can't have their own jobs and have their own health insurance. Is our health care situation in this country perfect? No, it isn't. But Republicans have over the years offered private sector and non-governmental solutions, and that's where we need to be looking. We don't need always to think that the federal government has to provide a solution. Because I think, in your own words, Mr. Pallone, I think you proved that this is a problem compounding another problem. There's a problem with Medicaid, so you look to the Class Act to solve some of the problem in the Medicaid. And all you do is compound the issue. So instead of looking for a way to fix Medicaid outside a government solution, you just want to pile on more government programs. We need to be thinking about these things in a very different way. We are destroying our country through additional government programs, through debt, through deficit. And it's time that people in this Congress started thinking about these things differently. Are there ways for solutions? There are. And I want to say I'm sorry my colleague, Mr. Sessions, left, because I want to compliment him on, I think, an eloquent speech that he made. And every Republican probably every day needs to say this, because we hear from you all every day. We don't hate government. We don't believe that there's no role for government in this country. There are roles for government in this country. The problem is we have gotten the federal government involved in so many things that we're doing a lousy job of what we are doing, and we need to focus more on the proper role of the federal government, and we could do a whole lot better job of that. So I think it's time that I agree with Congressman Boustany. Let's eliminate this program. It's not going to be able to be implemented. The president has admitted that. The secretary has admitted that. It's a failed program. It's simply a microcosm of the entire Health Care Act. The entire Health Care Act is a failed program. This is only one that you all have been willing to admit to. It's all a failure. and we're going to see these come up one after another. Let's eliminate them as quickly as we can and get on to doing things that we should be doing in this country, looking for real solutions and not for the federal government to be the problem solver of the world. Thank you, Mr. Chairman.
Thank you. Well, I have to respond to a few things that the gentlelady indicated. It's kind of putting false words in the mouths of Democrats. I don't think anybody here says there has to be a federal solution or that somehow Democrats are proposing federal takeovers of these various things. I think both sides have identified that long-term care is an issue for seniors in this country. I know my side of the aisle is very open to local partnerships, county governments, nonprofit providers, cities, states, for-profit providers. There's a lot of work that needs to be done. It's very easy to say something is not the solution, and I understand here you're saying this particular solution isn't going to work as it currently is. But fixing it, and that doesn't mean having some federal program that fixes it. It means fixing the problem, making sure that we have long-term care in place for our seniors. Again, through local partnerships, through counties, whatever the federal role may or may not be. I mean, there's lots of pieces to this puzzle. I don't hear anybody saying that this has to be dealt with exclusively by the federal government. In fact, it's not. Many counties and states are leading the way on long-term care, and others are lagging. So there is not this kind of false dichotomy here between one group that wants the federal government to do everything and the other that wants them to do nothing. I think there's a real problem. How do we provide quality, long-term care to our seniors that we as a society can afford? That's a problem. It's a challenge. To address that challenge requires policy thinking at all levels, requires reaching out to the nonprofit and for-profit sectors, and making sure that we live in a society that we can be proud of. So I think that's the real distinction here. And the problem with this bill as a standalone is, yes, it repeals a program that many of us agree won't work and needs to be fixed. But it doesn't take one step towards addressing the problem of how we provide long-term care for seniors in a way that our society can afford. So it's easy to figure out what doesn't work, but I think it's critical that this Congress begin the job of figuring out what will work for our seniors and what will work for our country and what will work for our federal budget. Yes, I have the time. I'll give you some time, sure.
Gentleman from Colorado, thank you very much. You know, the issue of fixing it, as you point out, and I guess advocating just leaving the provision in PPACA and let's work to fix it. The problem with that are twofold. The date that's looming, October the 1st of 2012, is what, 9 months away. And this is a sad commentary to make, I think, on both sides of the aisle, but the likelihood of us coming together and fixing it in this presidential election year, I think, are slim and none, and Slim has left the room. So we have this looming date, and I don't think there's any question, at least in my mind, and certainly in some of the legal minds from CRS in regard to this issue, could a plaintiff, could any senior who reads the law and reads this section that says the Secretary shall, by a date certain, approved by the Class Advisory Committee, have a program in place that they can sign up for and start paying premiums and looking forward to that long-term care. And we don't have it for them, and we're not going to have it for them. So I think to get away from the concern that I have, and we all should have, in regard to a legal challenge, and some appellate court may eventually say, well, you don't have standing and all of that. But during that protracted time of a year, 2, 3, whatever, I think the private, the marketplace in regard to coming up with a products for long-term care insurance so that we get beyond 10% of the eligible people signing up for it is a problem. So this is simple, again, a simple bill, a simple repeal bill. Once that's done, then the market can work its magic, and I think it will, and we can work together in a bipartisan way.
Mr. Pallone?
Well, I know, Mr. Gamey made a number of statements that I wanted to respond to, but I didn't get a chance. But this thing about CRS, they have not said that the Secretary would be sued if she fails to implement the Class Act. I think the Secretary, in making the decision that although there may have been some sustainable options, that she didn't feel that she had the legal authority to go ahead with those, understood fully well that she was making a decision, and like any decision that's made by any federal agency, there's always the possibility of a suit, but you don't repeal a bill just because somebody might be sued. I mean, you could say that about anything. I don't have any reason to believe that there's going to be a suit because of this. I think it's just really a false issue. The other thing I wanted to say, Mr. Polis, is that I'm not sure that I got it right, but I think one of you did give the impression that maybe the President or the Secretary has been supportive of repeal. Forgive me if you didn't say that, but I did want to make it clear that when the Secretary, when the Health and Human Services came before the committee and we had a hearing in the last few months, they did not advocate repeal. They were not saying that the bill should be repealed. They said what I've been saying, which is that, if there's some way to change the law so we can implement this in a sustainable way, we would welcome that.
Yield to the gentleman from Massachusetts.
I just want to say, again, one of the things that gives the people like me concern that there really is kind of a bipartisan recognition that this is a big issue is when you hear comments that compare long-term health care to swimming pools. I mean, it really, it just shows to me, I think, a lack of appreciation of how serious an issue this is. And the answer may be, a number of things. Some of it may be the private sector, but it may also be, a government role. This is a serious issue. It's not just for poor people, by the way. If you end up getting sick and you end up needing long-term care, middle-class families, even people who are fairly wealthy, can lose everything, in a very, very short period of time. This is a serious issue, and to say that that those of us who might believe that there might be a government role in supporting people to get this care, that all of a sudden we must be also supportive of maybe subsidization of swimming pools. It trivializes this debate, and also it makes me wonder whether or not we're all on the same page here. And I just say that for the record because my good friend Dr. Fox, mentioned that in her opening remarks. It bothered me that that was the analogy that was made. I think I don't think it belongs in this debate. Thank you.
I would agree. That troubled me as well. I mean, you have on the one hand a necessity, long-term care for our seniors, and on the other a luxury. I don't think anybody's argued that it's anybody's entitlement in this country to receive a luxury, that we somehow should be pushing Rolls Royces and swimming pools into everybody's driveway. But when you talk about the basics of life, food, health care, shelter, I think there's broad consensus among the American people that, yes, there should be a social safety net. We should not leave our elderly seniors alone and without care to die. We as a society have a responsibility to them. So there is an enormous difference between needs and luxuries, and it's a straw man to somehow say that any Democrat would propose that we build swimming pools, or any Republican would propose that we build swimming pools in everybody's house. That just doesn't make sense.
Would the gentleman yield? I thought I made it fairly clear early that this is a serious problem in this country and it needs to be addressed. And I say that not only as a legislator among our colleagues, but as a physician with years of practice and as the son of a father who went through a protracted illness. I understand the gravity of this, and I also understand the immensity of the problem affecting every family. It demands a real solution, and that's the key point. And the fact of the matter is the administration has come forward and admitted that this is not a workable solution at this, with what they have. And as my colleague here, Dr. Gingrey pointed out, and I pointed it out in my opening statement, we're talking about a rapidly looming statutory deadline. And so if we, as members of Congress, members of the legislative body, believe in the rule of law, then we have to take what we write into law very seriously. Otherwise, we start to undermine that whole concept of rule of law. For that reason, I believe it's important that we move forward. Let's repeal this. It gives us impetus to move forward. I think there's bipartisan agreement, certainly on Ways and Means, and I'm hearing it on Energy and Commerce, that we can fashion bipartisan legislation to get this done.
I reclaiming my time, I would just encourage the gentleman to approach this, the same rapidly approaching deadline in the lives of our parents and our grandparents with the same aggressiveness that we're approaching this particular statutory deadline. There is a rapid deadline for a solution, and that is the lives of our elderly today. Before I yield back, I'll yield to the gentleman from New Jersey.
I know that my colleagues have put all the emphasis on this deadline. What I was trying to say before, maybe I didn't articulate it well, the Secretary's made a decision, okay? And the decision is that she doesn't have the authority to implement this. I don't think that the deadline has any meaning once she's made that decision. That is her decision prior to the deadline. So I think this deadline is sort of a false, thing that's being put out there.
If I could respond to that, I think that would, again, that would be an arbitrary decision by this Secretary, which potentially is in violation of law, and certainly there's no prohibition to a future Secretary trying to implement a flawed program. So there are problems, and if we value rule of law, then I believe we should act accordingly.
Well, so too, as we both agree, there's a problem that needs to be addressed, with the long-term care for seniors. I'll yield back.
Thank you. I'll take just the prerogative of the chair very quickly to say we all believe this is a very serious problem. Not a single person on our side doesn't think it's a serious problem. It's why Republicans have worked so hard to save Medicare and why we have taken that on as such an important issue. And we think it's unfortunate that, again, our colleagues on the other side of the aisle haven't taken that as seriously as we have. Mr. Bishop, you're recognized.
How many guesses? No. Obviously, I came in late after your presentations. I apologize for that, but I walk slower because I'm older and closer to use to this program. And it also means that I've heard a great deal of comment here about a whole bunch of different issues. So let me just ask some of the simple questions. So, Dr. Bustani, Dr. Gingrey, in this bill you are repealing what?
We are repealing the CLASS program.
Okay.
It was a new program.
Why are you repealing it? Simply. Make this easy for me. I'm very slow.
Because the program is not actuarially sound and cannot be implemented.
And the Secretary of Health and Human Services, her position on this program was?
That the program cannot be implemented with current authorities.
So it can't work. So we're talking, we've had a lot of conversation.
Mr. Bishop, could you yield to me for just a second, because I think you addressed your question to both of us, and I would
but
just
I'm
say,
on a roll.
and I appreciate that, but let me just, and I'm not saying the Congressional Review Service is the last word, certainly not the last legal word, but in response to this question, and your question is, what are we repealing and why repeal it? And Dr. Bustani, of course, explained that. But in the Congressional Research Service report, it says very simply, a failure by the Secretary, Ms. Sebelius, the current Secretary, to designate a class benefit plan by October the 1st, 2012, presumably predicated upon a determination by her that it is not possible to develop 3 actuarially sound benefit plans that meet all the requirements of the Act, would appear to be a final agency action from which, quote, legal consequences will flow, unquote, inaction by the Secretary and designated a plan by the deadline could be found by a reviewing court to constitute noncompliance with a statutory mandate. Thus, after October the 1st, 2012, the Secretary's failure to take an action legally required of her would appear to meet the standard for judicial review of agency inaction unlawfully withheld under the Administrative Procedures Act, prescribing the scope of judicial review of agency action. That's pretty clear, and that's a real concern.
Mr. Bishop, could I just very briefly respond? what he's saying, again, we could argue as lawyers forever here, but what basically CRS is saying is that the Secretary believes that she's made a final decision. She was told by the Senate provision that she had to determine if there were any sustainable plans and if there was legal authority to implement them. She actually did have some sustainable alternatives, but she didn't think she had the legal authority to implement them. That is a final decision, as the CRS is saying. What CRS is saying is, someone can come in and say, okay, I want to appeal the final decision or argue that it isn't a final decision. But, I mean, this is true for any agency action. It's no different than anything else, in my opinion. So I think we're getting into all these legal things. That's not even what you wanted to talk about, but whatever.
No, that's right, because I'm a teacher and I don't care. What I really want to talk about is you're appealing a program, really appealing a program because it doesn't work. It wasn't implemented because it doesn't work. We've talked about social safety nets. Having a social safety net that doesn't work doesn't seem to make a whole lot of sense for anyone that's around here. If there is indeed a situation that is bad, Congress has two roads to take with it. We can either make it better or we can make it worse. Seems to me before this program was implemented, the situation was bad, and what we did in creating this program was to make it worse, not better. And I think the rational approach would be then to reverse yourself, go back, take this out, and then try to come up with something that might be, just might be better. But this ain't it. I guess the only other question I have, which I think is even more significant to the two doctors that are here, if I have a pain here in my shoulder and it comes down into my arms at regular intervals, does that mean anything to you?
Well, it wouldn't mean anything to me because I can tell you you're not pregnant, but maybe Congressman Bustani would like to talk.
Ask an OBGYN to something is it's just impossible here.
No, if you have a pain like that, that's serious. It has to be dealt with. It's a symptom of something
Now, are you going to
underlying.
charge me for that answer too?
No, I can't do that under congressional ethics.
Because I'm a school teacher, I don't have that much money.
And I can't afford the malpractice anymore.
Thank you. I appreciate the summarization of what we're really talking about in this thing, and a lot of different conversations. But the bottom line is, it's a program that doesn't work. Change it. I yield back.
Thank you. Mr. Scott.
Doctors, I find it kind of interesting, and it would be humorous had I not been sitting here for the last hour wondering why I was still here about 55 minutes ago. Because this is so simple that it doesn't bear much of a conversation. That we're talking about a benefit that would exceed $1 trillion on an annual basis for about 55 million Americans. There's no way for us to create a safety net in this program because a safety net seems to suggest that something can be saved. We don't have the capacity as a federal government to deal with this situation, and we need the private sector and the insurance companies to figure out a solution that we can't figure out, because if you have to go broke in Medicaid, there's a reason why. Because the federal government should not be your first course of action when you need something to be taken care of. And so I wonder why we're still sitting here, frankly, on something that just cannot work, because actuarially you can't find a solution and even a suggestion that someday we'll be able to pay for this.
Do you yield back? I yield back. Okay. Thank you. Mr. Webster. Thank you, gentlemen, very much for being here. Are we going to hear from Mr. Deutsch?
Thanks, you guys.
Mr. Deutsch, if you would come forward.
Thank you very much for being here, Mr. Deutsch, and thanks to Ms. Fox. And without objection, any prepared statement you have will appear in the record in its entirety. We welcome your summary.
Thank you very much, Mr. Chairman. Mr. Chairman, I have two amendments I'd like to speak to the first one, if I may.
Speak to both of them.
I'll speak to both. Mr. Chairman, I have two amendments. The First Amendment prevents the repeal of the Class Act if failure to implement the Class Act increases Medicaid spending. And this amendment is terribly important at this moment because as states continue to grapple with budget deficits caused by high unemployment, Medicaid is on the chopping block. And despite being the most cost-effective health insurance available in the United States, too many are joining in the familiar chorus that Medicaid spending is out of control when, as we know, it is poverty and joblessness that has swelled Medicaid's rolls. Since the recession, 1 million people in Florida have enrolled in Medicaid. It's no malfunction that in tough times when more Americans rely on the social safety net, maintaining that safety net becomes more costly. In Florida and across the country, state lawmakers are attempting to control costs by imposing greater cost-sharing measures and tightening eligibility. On the federal level, I've seen firsthand the fight over Medicaid cuts for our most vulnerable, the elderly, the disabled, the poor, and children. However, not all reductions in Medicaid spending are painful cuts. If we pass jobs legislation and put people back to work, Medicaid spending would drop. If low-income pregnant women had better access to prenatal care, Medicaid spending would drop. And finally, if more people had long-term care coverage and received needed premium finance care in their homes and communities, Medicaid spending would drop. Just 10% of Americans over age 50 have long-term care insurance, yet far greater than 10% are at risk for disability and frailty. The remaining 90% rely on Medicaid. That's why over a third of Medicaid spending is on long-term care. Currently, the system incentivizes poverty and forces seniors to blow through their life savings and spend down in order to qualify for help. What kind of message does this send? Save nothing, pass what you do have to your children before you get sick, own little property, and do not purchase long-term care insurance. Follow this plan, we tell people, and you will be eligible for expensive, institutionalized care through Medicaid. This perverse incentive forces struggling families into unthinkable positions. You take the example of a man in his 50s with early onset Alzheimer's. He's ineligible for long-term care through Medicaid because of his wife's teacher salary. Her $50,000 per year is too high for Medicaid, but not nearly enough to pay for nursing home care that can cost up to $90,000 per year in Florida. She could leave her job so they could fall into poverty, or better yet, divorce her sick husband, leaving him destitute but eligible for the most expensive long-term care available. A premium finance long-term care program would shift people from reliance on Medicaid. This should be our shared goal. We can do more than just shake our fists and scream about stopping spending. We ought to work together to fix a program that represents the first real path towards making affordable long-term care available. I ask that this amendment be made in order because the conversation about reducing Medicaid spending while improving the lives of seniors and persons with disabilities is a conversation worthy of this Congress. If Section 2 of the underlying bill would force states and the federal government to spend substantially more on inefficient long-term care, it should not take effect. Mr. Chairman, the Second Amendment prevents repeal of this Class Act until it's been replaced. The 112th Congress began with cries of repeal and replace, and while I am confident that the majority fully intended to develop legislation to reduce the number of uninsured by 32 million, expand Medicare benefits, help Americans afford insurance, and stop the worst abuses of the insurance industry, unfortunately, it's not happened. Both Democrats and Republicans agree that our country faces a long-term care crisis. The sponsor of the underlying bill acknowledged this reality just a moment ago. However, the bill before us boils a complex crisis down to 2 pages, most of which is conforming language. The fact is the title of this bill, the Fiscal Responsibility and Retirement Security Act, has been attached to language that will neither make our health care system more fiscally responsible nor bring the American people more retirement security. If it were mine to name, the bill as drafted would be called the Exacerbating the Long-Term Care Crisis Act. It's because this legislation fails to address the central problem plaguing long-term care in America, that it is unaffordable and it is out of reach for most Americans. This bill is no substitute for the Class Act, which provided our country with a modest framework for helping families, Americans with disabilities, and seniors attain coverage, and in doing so, improving their financial security. As we all know, the class program as drafted is facing challenges of implementation. Critics have focused on fiscal sustainability. If this is truly a concern, then we should work with this committee and others, as well as advocates for seniors and people with disabilities and the long-term care insurance industry, to provide greater flexibility, to come up with a program that could be designed that addresses adverse selection and improves market appeal as well. We must remember that even with implementation, class would only be a start. You know, in the infancy of Social Security, Senator William King, a Democrat from Utah, supported the Clark Amendment, which would have undercut the program. He was concerned that Social Security would crowd out private pensions, a similar concern to the one Mr. Sessions expressed earlier. He conditioned his support on guarantee that the Clark Amendment would be taken up later. But when Congress returned, Senator King was asked about the amendment, and he said, you can forget the amendment. The passage of the Social Security Act has got everybody thinking about pension plans. Americans ought to be thinking about long-term care now. We should all be lucky enough to grow older, but no one is immune from the frailty of old age. 7 out of 10 Americans need long-term care, will need it at some point after turning 65. No one is exempt from the risk of disability. And finally, I ask you to take as an example the case of Floridian Allen Brown, who in January of 1988, at the age of 20, was hit by a strong wave at the beach that caused a catastrophic spinal cord injury that leaves him a quadriplegic to this day. Mr. Brown has an endless list of expenses, from his wheelchair and medication to disabilities, accessible transportation, and long-term nursing care. Even while holding 2 jobs, he struggles to support his family in the face of rising health care costs. As lawmakers, it is our responsibility to remember that those who are young and healthy may not always remain so, and act on the fact that long-term health care insurance is out of reach for most Americans. Any one of us could experience an unpredictable accident like Mr. Brown did, and if that's not compelling enough, the inevitability of aging should be. What message is this Congress sending when our response to the long-term care crisis is just say no? Why should Americans be thinking about long-term care if our leaders in Congress are not? Our constituents are right to expect solutions from us. If the majority doesn't like the Class Act, they have the power to fix it or replace it. I respectfully request that my amendment be made in order because the American people deserve real solutions to real problems. I yield back, Mr. Chairman. I'm happy to answer any questions from my colleagues.
Thank you very much. As I said, your amendments, the first one is non-germane, the second does not comply with CUTCO. Are there any questions for Mr. Deutsch?
Mr. Chairman,
Thank you very much for being here. We appreciate it. Sure.
if I may have some clarification on the issue of germaneness.
Right. It does not comply with the rules of the House. It's non-germane to the bill, is what it is, and we can give you an explanation of that.
I'll look forward to receiving that.
This is from the parliamentarian.
I appreciate that. I would appreciate seeing that analysis, please.
Good. Thank you very much for being here. We appreciate it. We are going to recess for 10 minutes, and then we will be prepared to report out the rule. Okay. The committee will reconvene. We're here for further consideration of H.R. 1173, and looks as if the gentlewoman from Grandfather Community has a motion she'd like to offer.
Thank you, Mr. Chairman. I move the committee grant H.R. 1173, the Fiscal Responsibility and Retirement Security Act of 2011, a modified open rule. The rule provides 1 hour of general debate on the bill with 40 minutes equally divided and controlled by the chair and ranking minority member of the Committee on Energy and Commerce, and 20 minutes equally divided and controlled by the chair and ranking minority member of the Committee on Ways and Means. The rule waives all points of order against consideration of the bill. The rule makes an order the amendment in the nature of a substitute recommended by the Committee on Energy and Commerce, now printed in the bill as original text for the purpose of amendment, and provides that it shall be considered as read. The rule waives all points of order against the committee amendment in the nature of a substitute. The rule makes an order only those amendments that are submitted for printing in the congressional record not later than the legislative day of Tuesday, January 31, 2012, or pro forma amendments for the purpose of debate. Each such amendment may be offered only by the member who caused it to be printed or a designee, and each amendment shall be considered as read if printed. The rule provides that after general debate, the bill shall be considered for amendment for a period not to exceed 3 hours. Finally, the rule provides one motion to recommit with or without instructions.
You've heard the motion of the gentlewoman from Grandfather Community. Let me just say that we are moving into very, very unique waters here, a measure that is emerging from both the Ways and Means and Energy and Commerce Committee, but considered under modified open structure as something that is very rare. I suspect that our colleagues might still want to offer an open rule on this. They're welcome to do that, but the only constraints that will exist on this rule is that amendments must be printed in the record by a week from today, and there will be an overall time limit for consideration to ensure that as we seek to comply with the scheduling guidelines that we have, that we complete the measure in a day. And so let me just say again that I believe this is a great opportunity for us with this open process to be able to provide a chance for Democrats and Republicans alike to have an opportunity to be heard.
Mr. Chair?
Mr. Polis.
I have an amendment to the rule. I move the committee grant H.R. 1173 an open rule so that all members have the opportunity to offer amendments to the bill on the floor.
Heard the motion of the gentleman from Colorado. Any discussion? If not, the vote occurs.
Mr. Chairman, discussion.
Gentleman's recognized.
Thank you. I always seek to convince my colleagues of the righteousness of my viewpoints. In this particular case, I'm concerned by the 3-hour time limit. Effectively, if there are a number of amendments to the bill, they go chronologically according to the bill. So the start of the bill is amendable, and if there's enough amendments there, then the latter part of the bill, if you try to amend the final clauses of the bill, those would never be reached. So effectively, it would be a closed rule for those. So open to start, closed later. 3 hours is not a terribly long time for what I think both sides agree. Long-term care of the elderly is a serious problem that we as a Congress should address.
Well, let me just say to the gentleman, as I'm sure he knows as a member of the Rules Committee, the bill will be considered as having been read and open for amendment at any point. Any member will be able to offer an amendment at any point in the measure itself. So this notion of it being a closed rule is.
So then, so let me just ask a clarifying question. So if there are more people that have amendments than the time permits, it doesn't necessarily matter where they are in the bill to be excluded. It's just whoever presents it last.
That's correct.
And is it by order of who shows up at the floor to offer their amendment?
Let me just say that we've had 3 amendments submitted to the Rules Committee, none of which would be in order because 2 were non-germane and 1 did not comply with CUTCO. It'll be interesting to see, as we have this 3 hours of debate, how many amendments that would comply with the rules of the House will be offered. And so I think that it will be very interesting for us to see that. So
one additional question: if an amendment is offered that a point of order is reserved on and is found not to be germane, does that time count against the 3 hours?
Well, there's an overall time limit for consideration of the measure, the 3 hours. So yes, that's the 3 hours exists. Vote occurs on the Polis amendment. Those in favor will say aye. Those opposed, no. Opinion the chair, the noes have it.
Roll call vote, Mr. Chair.
Call the roll.
Mr. Sessions. Ms. Fox. No. Ms. Fox, no. Mr. Bishop. Mr. Bishop, no. Mr. Woodall. No. Mr. Woodall, no. Mr. Nugent. Mr. Scott. No. Mr. Scott, no. Mr. Webster. No. Mr. Webster, no. Ms. Slaughter, Mr. McGovern, Mr. Hastings, Mr. Polis.
Aye.
Mr. Polis, aye. Mr. Chairman.
No.
Mr. Chairman, no.
And the clerk will report the total.
1 yea and 6 nays.
And the motion is not agreed to. Are there further amendments? If not, the vote occurs on the motion of the gentleman from Grandfather Committee. Those in favor will say aye. Those opposed, no. The chair, the ayes have it. The ayes have it. And Mr. Sessions will be managing this.
And Mr. McGovern for the minority.
And Mr. McGovern for the minority. We have no plans to meet at all the rest of this week, and hope everyone has a nice break, retreat, whatever they're going to be doing. Without objection, the committee stands adjourned.